Our next session on the end of Roe versus Wade, health implications, navigating the complex landscape of women's health and legal rights, will explore the ripple effects on healthcare access and the potential consequences for women across the nation. So without any delay, let's call to the stage our moderator, Julie Harrigan, MD, founder and CMO of Physician EHR Solutions, LLC, and our panelists, Kayla Bryson, MS, owner and mental performance coach at KNB Sport Performance, LLC, Angela Dotson, president of Blake Brook Ventures, LLC, and Dr. Rebecca Johnson Osei, the CEO and licensed psychologist at Concierge Psychology. Hey, you know what? I think I'm going to take a minute and come get some coffee too. You know what? Why don't we all just take it? No, I'm just kidding. Stay in your seats. It's fine. It's all good. Last but not least, here she comes, everyone. All right. Here she comes, Miss Health 2.0.
Good afternoon, everybody. I'm Dr. Julie Harrigan. I'm the founder and CMO of Physician EHR Solutions. The reason that I'm coming today to this panel is very early on in my career, I did maternal and child health for about 7 years. So delivered babies, did family planning, did everything from, pap smears, colposcopies, and operative OB. So I'm very passionate about this topic. Before we get started, I'd really like to ask all of our audience and everybody on the panel as well, we've discussed this, is please, we're going to try to keep any political or religious bias out of this topic. It's a very sensitive subject to many and probably all of us, and to some degree. Some of us have had different experiences. So I'd like to see if we can keep this to a more scientific approach and keep some of those other controversies out of the subject. So without further ado, I will go ahead and let our panelists introduce themselves, and then we'll get started.
Hello, everyone. My name is Kayla Bryson. I'm an owner, mental performance coach with my own business, KNB Sport Performance. I offer mental wellness services and performance enhancement training to athletes at the youth and collegiate level. I got into this as a high school basketball coach. I will be going into my fifth year with the school in Sacramento, California. And being in a school from an inner city and leading young women has been a very fortunate opportunity for myself. And being able to bring that to athletes and them advocating for themselves from a mental wellness standpoint is a very new and growing field. The Association for Applied Sports Psychology is our governing body, and they advocate from youth level to professional level. And being able to offer those services, you see more professional teams bring in mental wellness departments into their teams. And as well, with my experience with foster youth, bringing that background into this conversation and being able to advocate for those individuals who do not have the resources available to them for reproductive health care.
Hi, everybody. My name is Angela Dotson. I am president of Blake Brook Ventures. I invest in small startup companies in the medical device space, but I'm also the COO of Alta Science Incorporated out of Dublin, Ireland, and we are bringing to market a world-class mechanical occlusion device for permanent contraception for women. And so I was very excited to be on this panel and to discuss this because especially with all the changes as we are seeing with Roe v. Wade and so many other things, the one area that we truly can agree on is that women have been left behind and they truly deserve innovation in healthcare. They deserve funding to be put towards things that can give them better outcomes in their health. And so it's very exciting for me to be here today to discuss all the things that not only is Alta Science doing to help bring permanent contraception options to women across the globe, but also to advocate on behalf of women everywhere that the time is now for everybody to get on board and get behind supporting women and being able to really devote some innovation and understanding that women make up 51% of the population. We're not going anywhere, and we need everybody to support things that matter to us, especially with our healthcare. So thank you.
I have my own.
You're very special. See, I have to share.
Hi, everybody. I am Dr. Rebecca Johnson Osei. I am a clinical psychologist and CEO of Concierge Psychology. So I bring the mental health side, although I imagine there's actually going to be a lot of overlap between all of us. This is something that I think is really important because, of course, I see the effect of pregnancy on pregnant mothers as well as on their spouses, and we shouldn't leave them behind. And of course, being pregnant is basically torture for 9 months if we're being really real with ourselves, ladies, right? For most people, it's hard. It's really hard. And of course, anything that is going to affect rates of pregnancy and women's choice, whether or not to be, is going to be significant. And that is completely aside from your feelings about abortion, but the reality of what it's going to mean for women and for the children who may be carried. And I think that's important in the conversation, even as it applies to, for example, stopping those pregnancies from happening in the first place if we're not addressing them once they have. So I'm excited to be here and have this conversation.
Excellent. Thank you so much. So for myself, my approach to abortion and pro-choice is definitely, very, very medical, because I've seen the good, bad, and the ugly of both pregnancy and non-pregnancy, contraception, trying to prevent pregnancies, and the consequences therein of. And women will go to extremes to prevent from pregnancy happening at times. Not only, it's not just about getting pregnant and having an abortion, but a lot of times the things that we do for contraception can be very harmful to our body. Things like operative sterilization, even going down to things as simple as birth control pills, which cause blood clots, IUDs, which can migrate. On a personal note, I was an IUD user. Mine migrated out of my uterus next to my uterine artery, and I had to have a hysterectomy to get rid of it. And there came with all kinds of perioperative risks and complications with that. And I'm a healthy, 44-year-old woman that, runs many marathons, so I'm not the larger majority of our population that's at my same age, which could have a lot of complications associated with that. So I'm going to delve a little bit more into that further on, but I'd like to hear, a bit more from our panelists about, their viewpoints and, why we're so passionate about these topics and why it's so important to bring awareness to our female population and our male population about this very controversial topic. So Kayla, I'm going to have you kick it off.
Yes. So my background is majority with youth level. And so individuals under the age of 30, just looking at starting with the youth level, like the education that we have for sex health, sex education, the community that I'm a part of that I coach with, we see them exposed to sexual media just at younger ages. And being able to face the reality that we have younger individuals that are sexually active and maybe not necessarily having birth control be the first option for them, but navigating the education and them being smart about the choices that they're making. And as well, just underserved communities, minority population. We even see this with professional athletes. Mothers recently as Olympic track runners, Sonia Richards-Ross, Tori Bowie, who unfortunately passed away due to having complications while going into labor in her home by herself. Tennis star Serena Williams, she as well nearly died giving birth to her first child and is currently pregnant with her second. So hopefully she does not go through those complications that she endured again. But bringing to the forefront that it's not just wealthy or poor individuals, it's wealthy individuals as well this is affecting. And understanding that we need to navigate other options besides birth control, advocating for if an abortion is the solution or the solution for somebody and it's what is going to keep them alive, then respecting that decision and understanding that was needed for their health.
Thank you for that. So, whenever I take a look at this, I mean, my views come from so many different perspectives. Starting with just as a woman in general, but also a mother of a daughter that is, getting ready to be 3. And as I look into, her future, and I see this, and I think to myself, whenever you're talking about abortion and the whole Roe v. Wade, there's never going to be a consensus. You're never going to have 100% of everybody agreeing on this because it is such a personal topic. And it's not just the topic that's personal. When it comes to women's health, it is so personal. Everything about it is personal. Every woman experiences something different in their life. But the one thing that we all can agree on is that it's something that we all share. We all experience a menstrual cycle. We all experience, the pains that come along with women's reproductive. As a woman, we all share that. But our experiences with it are all different and they're all personal. And so you cannot, no matter where you feel on the matter, from a political standpoint or a religious standpoint, you can't discount somebody else's feeling or emotion about these things. And so for me, what I want to be able to bring, and even if it's in the smallest capacity, is just what solutions can we attempt that can try to help everybody? Where can we find a common ground of meeting in the middle with this? Where are the places that we can agree that need to be focused on, that are true problems? And how can we come together and create a better opportunity for women so that their health is protected, that the future of generations, our future children are protected? Because this topic is so much more than just a black and white topic. There's a whole lot of gray in there, a whole lot of gray that affects men, women, children, everybody. And so I think that that's, for me, that's where it begins. And, where my heart is I'm not going to be able to convince people, and I don't want to convince people to share my view. I want to respect everybody's view. But what can I do to help everybody find a common ground so that we can move forward and we can make it better for everybody? So that's kind of my position, and that's why I'm here, and that's what drives my passion. Sorry. Listen, I don't learn quickly.
I know I
Just
share
sorry.
this way too. I really appreciated what you said about solutions, because I do think that's where we are right now, right? I mean, advocacy and such aside, this is post Roe v. Wade turned over. This is the reality we are living in, regardless of how you feel about it. For me, being a woman and everything aside, from a therapist standpoint, I find myself sitting here thinking, okay, I'm going to see these women. They're coming to me. I hope they're coming to me. Let's put it that way. Hopefully they're going to somebody. I'm going to see I don't work with kids, but I'm going to see those kids when they grow up. Because, like I said, this is going to have a mental health impact on people. And we can preach that you shouldn't be an adult having sex, I guess, but that's not an actual solution, right? When you pull Viagra from the shelves, maybe we can have a conversation. But until then, if men can have fun without needing to make babies, then let's not preach at the women, okay? So this is going to happen, right? People are going to have sex, and contraception is problematic, and for a lot of reasons, right? I mean, you mentioned hormones. I can't tell you how many women, something about hitting 30. If anybody here is about to hit 30, I see these women have been on the same pill for 10 years, and all of a sudden at 30, it's just they're like, I feel like I'm losing my mind. And what happens? They get taken off the pill they've been relying on this whole time. Condoms are great. Condoms break. Condoms are expensive. Back to how this hits certain groups. Do you have insurance? Because these other type things require insurance. So all that is to say, pregnancies happen. So now you have a woman who is pregnant and doesn't want to be. And we're asking her to, not eat ham. And actually, I think you know sushi now. But, we have this laundry list of things you're not supposed to eat. You can't take Tylenol or Advil now, apparently. Now it's an association with autism. So you hurt, too bad. You just get to be in pain. You're exhausted for 9 months. Wow, that's too bad. You can only have 1 cup of coffee a day. They're not having this cup right here, right? There's a lot that goes into this. And in somebody who wants that baby, it's still hard to follow all of those requirements. So now imagine the mom who doesn't want this baby. And is she following them? Like, what is happening to this fetus during gestational period? And are they getting prenatal care? Are they even telling anybody? I'm sure you guys saw the article about the twins that were found in a trash can recently in maybe Oklahoma, which is super tragic, but those things are going to happen. Some people are going to carry to term and just say, I didn't want this kid. And it's horrible, but it goes back to solutions. So how do we help women and men? There actually is a shot for guys that I take a pill that makes it so you can't get women pregnant, but they can't get traction because nobody wants to take it. So that's a whole other conversation. But how do we get there so that people are supported in not getting pregnant in the first place? But if they are, I think we need to find a way to, in our current day, support those women, try and make it, I guess you could say, as easy as possible to be pregnant for that time period. Be there for the babies after the fact. Because even if this baby is born and is adopted by like the best family in the whole world, if they haven't gotten prenatal care, if anybody here has ever visited like a third world country or just a poor area in general where there isn't prenatal care, it's very obvious. You have much higher rates of a lot of deficits, cognitive and physical, if those kids are not given up for adoption and they are raised by parents who don't want them. I don't think anybody in here needs me to really spell out for you the emotional trauma that's coming from that. And so I just think it's very important that we be very aware, because this is just the beginning of that. And we're going to see a lot of adults 20 years from now who are a result of this. And there are going to be repercussions that I think we need to be preparing for, while also hopefully thinking of ways to help minimize the number of people that are coming into the world essentially unwanted from the first day.
Yeah. So let's rewind. So we talk about pregnancy, as if it's an easy thing.
It's the flu for 9 months.
Yeah. It's the flu for 9 months. You get fat and then you try to get skinny again. And no, the number of complications that are associated with any given pregnancy at any given time are fantastic. And when we're talking about a 23-year-old girl who, got pregnant, because they didn't use a condom, the condom broke, she forgot her pill, whatever, the scenario is, we think of, healthy 23-year-old's going to have a baby. This is going to be great. We're bringing life into the world. Fantastic. What about the 45-year-old woman who is having menstrual irregularities because her ovaries are kind of sort of shot? She's already got 3 kids. They're either in college, out of diapers, in various stages of life. She's got diabetes. She's got hypertension. She has skin disorders. She has asthma. She's got post-COVID syndrome. All of these different things. Cardiac disease is not unheard of at all. Substance abuse. So, if you think of when we talk about crack babies, we're talking about babies who are born in active withdrawal from heroin. And when you talk about these pregnancies, it's great to idealistically, and I think, that's in the minds of the people who are making these decisions, idealistically, pregnancy is a beautiful thing that results in a beautiful being that's coming into this earth and, and it's wanted and it's loved and and it has every chance to thrive. And, the sad reality of that is that in many cases, in most cases, in these cases of women who are seeking, to terminate their pregnancy, it's because of a very good reason, and so I think we have to question ourselves, who are appropriate to be pregnant in the first place, an oops pregnancy that you go, okay, well, it's no big deal. I'd love to have another baby. Great. But an oops pregnancy when your last pregnancy was wrought with preeclampsia, seizures, blood clots, postpartum cardiomyopathy, liver failure, kidney failure, diabetes, gestational diabetes that resulted in permanent diabetes, other high blood pressure disorders, blood clots to the brain, complicated C-sections, crash C-sections, severe bleeding that causes your pituitary to completely implode, making sure that you're going to be on prednisone for the rest of your life and severely immunocompromised. I mean, these are the things that happen with everyday run-of-the-mill pregnancies. And then consider, well, I shouldn't be pregnant because I had these things in the past. And what that fear, and just imagine what that fear has got to instill in you as, as a patient, knowing that, oh my God, if I get pregnant again, I could die. Nobody cares. I don't have a choice. So I think that, from a medical standpoint, again, advocating for, not only women, because I'm obviously one, but, or maybe not so obviously, but I hope so. But, being that person, knowing about these complications and these bad medical things that can happen, that can ruin people's lives, and then not having a platform to advocate for them is, it's a difficult topic.
Yes, I'm glad that we brought up earlier with pregnancies that are unwanted, but women go through with giving birth, bringing up the foster care system and adoption. With the foster care system, it is unfortunate with the children that I work with that they come from homes that either drug use was present, abuse was present, or parents were just not fit to take care of them for whatever reason. That we all know that the foster care system is very broken. Many of these children do age out of the system. And then from there, they still rely on services for them to transition into adulthood, sustain themselves financially, education system as well. They do not have examples put forth in front of them to show them what is possible for themselves. And so many of them do rely on other circumstances to be able to live off of, whether that is drug use, gang affiliations. And many of these youth do not have the resources present. However, the agency I work with, we are there in home stand-in parents for them. We are there to hopefully help them sustain a living. But if they're put in a situation to where other individuals in their life have a stronger influence over them, it's a broken system that does not cater to their needs and finding families for them. It is fortunate enough that some do reunify with their birth families, but that is not the case for a majority of the population. So being able to reevaluate what we're bringing from others and that support to say, if they realize that they may not be ready to become a parent, being able to combat situations where they can sustain healthy bodies, healthy mindset, mentally, emotionally. And hopefully that's a discussion like this can be able to change the narrative around abortions and birth control.
Can I piggyback on that, actually? Just because I think you brought up such a good point. I used to do parenting capacity evaluations. So when somebody's children were taken away, they'd be sent to me to essentially evaluate them and say, essentially, whether or not they seemed like they could be a safe parent and what they would need to support them in order to be able to provide a safe space for their children. I also worked in juvenile hall, not at the same time, but they kind of interestingly intersect. And I just think you bring up such a good point, and it kind of loops into what we were saying before, which is that support piece. If we're going to say all of these children must be brought to term, period, end of story, there has to be funding to support that then. Because whether or not these mothers should be supporting their children and being a good influence, et cetera, so forth and so on, doesn't mean they will or can, right? There's a can here. If you already have multiple kids and 3 jobs, I mean, how much supervision is this last kid really going to get? And is it realistic to expect that? And again, we can high horse on whether or not this person should have gotten pregnant, but now they have, and now there's a baby. So as a society, we need to figure out, and this, I know this becomes political again to a degree, but this goes into, you can't say all babies come to term, but we also are going to pull funding for support for social services, for things like that. It's kind of a one or the other, or else, yes, the kids end up on the street. And guess what? I mean, really, what happens with any of us when we're like a teenager and left to our own devices? I mean, who in here was like, I was up to all the good, right? We're not. And yeah, and they seek out support. They seek out peers. Juvenile hall is statistically shown to actually make kids worse, not better. But we keep putting them in there, and then they get to meet other kids who are great examples. And I just think that was such an important point, because if we're going to have these babies born 6 months from now, 9 months from now, those kids are going to need those social supports from somewhere.
No, you're fine. And I completely agree on that. And we kind of touched base on this yesterday and into last night, but it's when you're looking at the support system, and that's really what we have to do right now is come up with solutions. And when you look at the solutions for these kids that are being born from parents or women that don't want any more kids, then you look at, okay, where are they going to go? And if the foster system is failing them, and then you look at the other option, which has bothered me greatly for a very long time, which is the adoption side of it, because it is so costly and almost impossible for somebody to adopt. And it's like, what options are you giving people? Like where are the solutions? Where are the solutions? You can't just make this a rash decision subject because it is in the moment, making you feel like you're getting brownie points with, certain people versus others. If you're not willing to take a step back and say, okay, well, you know what? We need to look at how we deal with adoption in this country. And we need to be able to make it so that the families that want children, maybe they can't have children, but they want children, they can be able to take those kids in and they can provide them the life and the support that they need. But we're not doing that. So that's an area that we have to focus on. The other area, and you talked on it yesterday, is, the education. We need to be educating. We need to be educating, the kids at a younger age about sex, because, to your point too, it's happening. And as parents, listen, do you think that I want to really ever have to have the sex conversation with my daughter? I really want to believe.
Gonna happen.
I want to believe. I want to believe that she is going to be the perfect little angel, and probably until she's going to be a virgin until the day that she gets married. I hope that happens. Probably not going to happen. So
I feel like we should ask the men what age they think girls get their period.
I mean, seriously.
Like 10, guys. 10.
That was my
So I mean, I think as parents, as parents, there comes the responsibility for us to have common sense and to take ownership of being a parent to our children, and knowing that our kids are going to mess up. They're going to do things that we probably don't want them to do. And we need to play devil's advocate and have a plan B for when they fail at plan A.
Like literally? A plan B? Literally? Like
I mean,
it's crazy.
I know. So there's so many conversations that surround this that really needs deep thinking. And to your point, Julie, when you talk about the older women, like I'm getting ready to be, I don't know if it's 43 or 44. I always forget.
I thought about lying about my age.
It's one
Did you just make us older?
It's one of the ages. Well, Julie's 44, so I'm right there with her. So, but I'm one of these women that I struggle with hormones. I had to do IVF for both my children. It was extremely difficult. It took a toll on my body. I do not do well with hormones. Mm-hmm. That is common amongst so many women. There's a lot of women that can't even take hormones, period.
And IVF is less expensive than adoption in the United States.
I mean, it's nuts. And so, when you take a look at that and you look at what are the options available for women like me, women that are in the prime of their life, they're, career women, maybe they just don't want any more kids. Heck, maybe they just don't want kids at all. And that's okay too. What are the options for them? And it's sad to see that it's so limited. The only option for permanent contraception for women right now, truly, is tubal ligation, and that is
Hysterectomy.
yeah, or take it completely out. I mean, that comes with anesthesia. OR, it's very expensive. You're out for days with work. We know that women are working more than ever before. They can't afford to be able to do that. That in itself really impacts, from a socioeconomic standpoint, all different people across the globe. And so, one of the things for a solution is innovation. And, I'm very proud of that, because as COO of Alta Science, we are working on a contraception device for permanent contraception for women that's non-hormonal, doesn't require anesthesia. It's a minimally invasive in-office procedure to be covered by insurance, something that women can just go into their doctor's office and be able to, 30 minutes later come out and they have a permanent contraception option for them. And these are the types of things, when we talk about solutions, we need people to get behind. So what I say is to all you investors that's in here, come see me. Let's talk about how we get these things moving along for the women of the world, because we need people to step up. We need innovators to step up. We need investors to step up. We need everybody to start stepping up and talking about all the different things that affects this important topic about bringing children into this world and the effects that it has on women's health in this world, because it affects us all in so many different ways, and there's so many different layers. And I just get very frustrated that it's being made to just be in a black and white topic when it's anything but. Sorry.
Well, talking about resources, resources for healthcare in this country are, so disparaged. You've got your good resources in your main cities, in your rural towns, in your border towns, in your, middle of Arkansas towns. You're going to have extremely, deficient resources for medical care. I mean, they can't get doctors out there. They're doing telemedicine visits with absolutely no doctor present, just because nobody will physically be at these clinics, at these hospitals. And so what happens to prenatal care? So, in the state of Texas, and I just read this a couple days ago, I don't know if you guys saw this on the news. And I try not to watch the news too much because it's really depressing most of the time. And this was another, depressing statistic, but there were 10,000 extra deliveries in Texas alone since the abolishment of Roe versus Wade. So since the state changed their legislation, 10,000. So can you imagine all of the rural towns in the middle of Texas that are emergency access hospitals that are only run by CMS? They don't have any other regulatory bodies running the show. They have to only do telemedicine visits, and they don't actually have somebody to physically examine these patients, and what kind of care they're receiving for this pregnancy that they didn't want, or was maybe very inappropriate in the first place. We haven't even gone into the subject of rape and incest and all of these other things that clearly there's the I don't give a damn, policies about. And again, I'm not going to politicize this, but it's very interesting to see, the mental, physical health of what's going on behind the scenes. So, because this topic is so far beyond just pregnancy. Now, on the flip side, I also want to, kind of talk about the resources for women in the certain states that have abolished these policies. And so again, try not to read the news, but I was bored and I was actually boarding my flight here, reading this article about this 45-year-old career female. She was in Louisiana, and she did this very, she went kind of undercover to give this, testimony in this article that I read. But 45-year-old female in the state of Louisiana who accidentally got pregnant on contraception. So she was actively trying to prevent a pregnancy, and like everything else, fails. It's only 99.7% effective. Well, that 0.3 bloody ineffectiveness is pretty big when all of a sudden you're 5 weeks late, right? And so she had to. And the four surrounding states around her also have similar policies. So there was really nowhere for her to turn that she could just drive to and have her abortion. And so she ended up flying to Oregon, being there for several days for the counseling, for all of the things that, that they do very appropriately in Planned Parenthood. I worked for Planned Parenthood very briefly just because I really wanted to educate myself about, what happens. I mean, you just go to the clinic and get an abortion. They're like, oh, here's your pill. Yeah, no, go bleed and be gone with you. No, it's a huge process. And they do a ton of counseling. They do a ton of measures to make sure that you're sure about your decision, and again, not always for the right reasons, not always for the wrong reasons, but for whatever reason. And so this gal flew over, took several days, and she had to take her final pill right before because she had to be back to work the next day because she'd already taken multiple days off of work and she didn't have any PTO. She had to take her final pill as she was boarding the airplane for a 4.5-hour flight back to Louisiana, and bleeding heavily, cramping, bleeding, hurting, emotionally distraught, all the way back to her state, because had she taken that pill at any other point, it would have been illegal, and she would have been persecuted for it. And so, just to go and, understand, and she's one of the lucky ones who had the means to get on a plane and go do that and fly back, and, and had some reasonably good, healthcare along the way. But again, from a medical standpoint, what's going to happen when we go back to, the 1950s? And I'm sorry, and I know that this sounds very crude. Coat hanger abortions are not something in the past. Those are happening now. And they're happening at an alarming degree now that we don't have these policies in place to protect women and help them, again, maybe not do the right thing, maybe not do the wrong thing, just do their thing, but in a safe manner, and then have that health care, have that mental health support.
I think it'll be really interesting. That's like the least opinionated way I can put that, to see what maternal and fetal death rates are in a few years. Percentage wise, right? Because of course they'll go up because the number of pregnancies go up, but you can always look at things proportional. And in theory, if it's just more healthy pregnancies, that wouldn't go up. But I do suspect for a lot of the reasons you listed, so some of them being pre-existing conditions, some of them being women maybe doing unsafe things to try to end the pregnancy, and some of them being what I spoke about, which is women just not getting care, even when it was available. So not even the places where you can't get it, but when it is available, but the women just either themselves, we like to think that everybody loves their baby, right? But there are some people who should not be parents, period. That's it. And now imagine that person is pregnant. They are not going to do all the things you're supposed to do. And I think all those things combined, I think we're probably going to see some scary numbers, truth be told.
I agree. And, and mental health, is hereditary, right? Substance abuse, as well. And, where do we draw the line at these, mental health, physical, emotional, implications? Where are we going, and do we have the resources to do anything about it? That's the tough thing. I'm sorry.
Yeah. And, one of the things that since I have been here at this conference and been getting ready to prepare to speak on this panel, it's been really refreshing to be able to know that it's possible to be able to have these type conversations, even if you are, coming from a different approach. For example, I'm pro-life. I'm pro-life. It's a personal decision. And I think that's something that everybody has to remember. It's a personal decision. Our goal is to be able to have these type of conversations and be common sense to understand that what is happening, this places such an impact on the mental health, on the youth, on the middle-aged woman. There's so many different facets of it. And so it's been very refreshing to me to be able to have these type of conversations with, people here. And I thank you all for that, to be able to sit down and really talk about, what needs to happen. These are the challenges that we're all facing as women, and I'll throw you guys in here as well because you're included in this. But it doesn't matter where you are, where you fit on the spectrum of pro-life, pro-choice, whatever. At the end of the day, we're all human beings, and so we need to make sure that we are supporting each other and we are finding the best solutions to everything. And one of the challenges, and when we talk about all the things that we need to think about how this impacts us, one of the things that we don't talk about often is childcare in this country and the lack thereof. Let me tell you something. I live in a very rural part of Southwest Virginia. The opioid use has ran rampant in my area. Now, I'm from there. I've grown up there. I love there. It's all the reasons why, I moved back there to raise a family, but it's changed. Society is changing. And the drug use has really become a problem as such as it has in so many parts. And it's very hard to find childcare. And even, for me, I have one child. My first daughter, unfortunately, passed away unexpectedly shortly after birth. So I had 2 daughters, but I have 1 living daughter. But even with 1 daughter, for me, the challenge is that it has been many, many days whenever I haven't been able to find daycare for her because the wait list is so long. And I have literally had to take almost all of vacation time just to be home with her to try to find somebody that could come in because my family lives over 2 hours away. They all work. It's not easy. And you can't just trust your kids with anybody because so many people you don't know if they're on drugs. You don't know if they're going to be taking care of your kids. It's an issue. There's so many parts to this of having to plan. And if these conversations and these decisions for women are going to be made, there's so many things that need to be addressed and needs to be talked about and solutions being able to be provided of how it affects the household, how it affects how it affects them financially, their careers, and everything in between. So just food for thought.
So I'm going to take women out of the equation for just a minute. And I'm sorry, and I'll be super brief, Carol. But on the note that you were saying about your baby girl that passed away, let's take women out of this equation and let's talk about the babies. Let's talk about heart conditions. I mean, we saw a little sweet baby boy yesterday. I'm one of the keynote speakers, and they were talking about this sweet little baby boy with a heart condition that had 3 open heart surgeries. Let's talk about, actual chromosomal anomalies, babies born with no brains that pass away right after surgery, right after they're delivered. Let's talk about trisomy 18. Let's talk about Down syndrome. Those are very, and when people are like, well, I'm not worried about, and this is a common thing that they say is, I'm not worried about having a baby with Down syndrome. I can take care of, I'll take care of them for the rest of their lives. But there's so many other genetic disorders. There's so many other birth anomalies. There's so many other things that these babies have to suffer that maybe wouldn't have to have gone through that. And whether their life is long and fulfilled or whether it's very short and snuffs out within hours after birth, let's talk about the babies too. I mean, our NICUs are full, our pediatric ICUs are full, and they're full of kids with cystic fibrosis. I sat for 10 years, almost 10 years on the panel of Make-A-Wish Foundation. So, let's take this conversation away from the moms and away from the politics and also think about those babies that, maybe just needed a chance to be in heaven, or wherever you'd prefer that they be. So just, sorry, from a medical standpoint, I think that that's something to really highlight.
No, thank you, Julie, for bringing that up. Among the experiences besides sports and foster youth, I as well have experience with being a behavioral aid for special needs students, and the toll that some of those experiences take on families is tremendous. Not only if this is their only child, but if they have additional children, the lifelong health issues that some of these children experience is very heartbreaking. I've dealt with Down syndrome, autism, cerebral palsy, not only factoring in the health side of it, but then the resources in schools that are going to be needed for them with speech, OT, physical therapy, just some of these extra services that are needed for a child to thrive amongst the general population, as well as integrating them into the general population of their schools, whether that is the public or private level. And just understanding that genetics play into that when a mother is having a baby, and understanding that, is a parent willing to take on that challenge of understanding that, okay, when the parents are no longer around, if this child outlives them, who else is going to be there to take care of this person?
So we have 4 minutes left. I'm going to leave room for questions. And I just have one funny closing remark because we talked about it yesterday. Abstinence only doesn't work. Just saying. I'm going to leave it at that.
What?
I said abstinence only doesn't work. I'm just going to leave it at that.
No, it doesn't work. If I could take a second, I want to do a little thought exercise with all of you. That's all you guys to help me with this. Okay. Let's make sure everybody's awake. Can we all at least agree that a child who is born but not wanted, so mom doesn't come around halfway through and is super excited, a child is born to a family that is not wanted, is most likely not going to be loved and supervised the way we would ideally like? Can we agree on that as a room? Okay. So, unloved child. Anybody who works with children, what do unloved children do when they go out into the world? What do they seek out? It begins with an L. They seek out love, right? So, Susie, 10-year-old Susie, doesn't feel love from mommy, so she goes out seeking love, and she finds love in Johnny. And when Johnny says, "I love you, Susie,"
And her first menstrual period was at the age of 9.
yeah, because this happens like a lot. I feel like many people don't know this. What does Susie say no? What do you guys think? Susie, who is seeking out love, is unloved at home, is not supervised, probably not being told by mommy what to be careful about. And here's Johnny. And Johnny loves her, but Johnny might not love her anymore if she doesn't have sex with him. What is she going to do? She's going to have sex with him, obviously. Come on, guys. So I just want to bring home this full circle. So, 10 years from today, there's going to be Susies. And there's going to be Johnnies too, who also are looking for love. I'm just, and just going back to resources, support, all of that. What are we going to do as a society to make sure that Susie doesn't fall in with Johnny, or that Susie has whatever resources Susie needs to make sure that Susie doesn't make Susie 2.0 10 years later?
And maybe Susie and Johnny have early HPV and have given it to each other and don't get really checked out. And she ends up with cervical cancer and he ends up with penile cancer. Lots of problems
Well,
there.
that might end the cycle, I guess, though. So
That's a long way cycle, but it does happen. So y'all, we've got 2 minutes left. I would like to leave room for questions. If there are no questions, then we can powwow a little bit more.
only easy ones.
Yes, ma'am.
Thank you for the discussion that was able to take in all sides. And leaving out political and religious aspect, I am a nurse, and I want to ask the question in regards to let me just stop. Solution. I'm gonna start there. I agree with the solutions and think it's very much needed for areas of contraception to be addressed. I think that is something that needs to be more readily available and not with the side effects and harmfulness that women have to have by having all those options. I think
Yes,
that is
ma'am.
something that needs to have more research, more tools available as a solution. As another solution, now that we're here, I agree, we need to have more mental health services available to service women that are going to go through the emotional challenges associated with having to have a pregnancy. At the same time, there has been, we've gone through seasons of, there has been Grief, shame, guilt, and trauma tied to people having abortions that we did not service well.
Yes, ma'am. Mhm.
And I just want to pause on that. We went through decades of not servicing those women at all. It was not even considered. And now the effects, decades later, of that trauma, that shame, that guilt, they've lived with, and we still didn't address with it. My question has to deal with what happens in the mind when we disconnect. If life is life, I'm just asking, if life is life, what happens in the mind if you have to disconnect from it to make a choice? And I'm asking that because I forgot your name.
Angie.
Angie made a statement. She said she had 2 daughters, and she grieved one daughter that didn't live long after birth. We now have in my state where there's perinatal, which covers after birth.
Mhm.
Okay, that abortions can take place. What is the mental effect, if life is life, what is the mental effect of the trauma women have had to endure on both sides of the spectrum? Because trauma is trauma, and we've not put anything in place as trauma as a component of women's health and wellness, of treating trauma.
So I'd be interested to kind of dissect that a little bit. So the VA has, multiple systems in place to deal with soldiers with PTSD. And I can't quote the article, and I don't remember when it came out. Anecdotally, I remember reading, because I do read all the time. I just don't watch the news because it's depressing. But anecdotally, I saw an article years ago, and this was when I was in my maternal child health days, that said that the emotional equivalent of the trauma of a woman having an abortion was very similar there too, in the small amount of studies that they've done, to some soldiers that have come back, to policemen, firemen, and some soldiers that have come back from war, because ultimately they're doing away with a life. And so it's not just that you're getting rid of, something inside you, you're doing away with a life, and the trauma associated with understanding the implications of what you did and potentially how it was done, right? Because it's not pretty sometimes. Is very traumatizing, and it can leave very lasting effects, very similar there to those other, professionals that are in very traumatic situations and jobs.
Yep. And thank you for that. But, I can, speak from my own personal experience here. My mindset has shifted so many times over the years in regards to, is abortion okay? Is it not okay? And like I said, I mean, I am pro-life. I'm pro-life, and I became pro-life after I had to do IVF for my girls, because I wanted to be pregnant so badly, and I had unexplained infertility and could not have kids. And it was something to be able to be a part of that and seeing it, from the time it was an 8-cell embryo through, and really understanding the whole scientific process, right? But at the same time, it also did not, it didn't make me lose the common sense piece about it. And especially after I lost my first daughter, because let me tell you something, the hardest decision for a parent is the decision to end life for your child. And the reality is, until your child is 18 years of age, if something were to happen to that child and they were to have to go on a ventilator, and lo and behold, they become brain dead, you're going to have to make that decision. Do you pull life support from your child? You're going to have to discuss with your physician all of the options, all of the scenarios in which if you leave them on life support, how long could they potentially, live? What kind of complications that they could have. And for my husband at the time and I, we had to make that decision 29 hours after our daughter was born unexpectedly. She was born with several complications from a labor complication, a delayed labor. And should she have lived, she was going to have severe cerebral palsy. And her organs started failing. She ended up having a seizure on the brain. And we had to make the decision, do you want to put her on life support? This is a child that we prayed for. We wanted more than anything in this world. And we still had to make that decision. And so I think about that often for women who become pregnant and maybe they don't want the pregnancy, or maybe they do want the pregnancy, but they find out during their pregnancy that there is something so severely wrong with their child that they're not going to make it. Should they not be given the same option and discussion and respect that my husband and I had once our Audrey was born? These are the questions that make me have what I call common sense, because they're real. These are real realities. Everybody's journey is different. And it's not easy. It is traumatic. And I can tell you that making the decision to end a child's life at any point, it is traumatic. It will haunt you. It will be with you for the rest of your life. And if you don't have it immediately, regret happens at some stage in life. And you better be prepared to have those conversations about it. So I appreciate and respect your question around that, because it's absolutely relevant, and it's absolutely why, I'm so strong with this not being a black and white topic. And it's not as easy as saying that all abortions should not happen or all abortions should happen. There's a lot to think about. And my experience alone is just one of those.
So everybody, thank you very much. Wonderful statements, questions. I appreciate our beautiful panelists.
Thank you.
And thank you for your time, everyone.
Wow, what a wonderful and insightful conversation. Thank you to our panelists.